where the people are already compromised, having compromised lungs. That we are going to talk about today. Let me first introduce all of you before I start the ball rolling. Also, I'd like to share this program is brought on by the Climate Channel Canada, also with the Plurals India and the No TV Bangla, a Bangladeshi YouTube channel which is having more than 80,000 subscribers. With that, let me introduce the panel for you. I have a fantastic panel across the world, should I say. I have with me Professor Abdul Salam, professor in Dhaka University, and an air pollution expert, I think working in tandem with various experts across the world. Welcome, Professor Salam, into the program. And I request all of you to get unmuted, keep yourself unmuted, both audio and video, so that it will be comfortable for all of us. Let me also introduce Professor ASM Amanullah. Professor Amanullah is the professor of sociology in Dhaka University, having an experience in this sector for more than 2.5 decades. Welcome, Professor Amanullah, to the show.
My pleasure.
Absolutely, thanks, and it's a great privilege to have you. I have with me Professor Rajiv Dashgupta, a professor of public health in Jawaharlal Nehru University, Delhi, India, and also part of various key committees of Government of India on this virus and also the vaccination. So would like to hear a lot about the situation, the latest situation from Professor Dashgupta. Welcome, Professor Dashgupta, to the show.
Hello and good evening.
Absolute pleasure. I have with me Anumita Roy Chaudhary. Anumita is an environmental expert from Center for Science and Environment, Delhi, one of the strongest and I think loudest voice on the agenda in India and South Asia, now also in Africa. So Anumita, it's great to have you back again in the show. We had jammed before. I think we'll be jamming today itself. Welcome, Anumita.
Absolutely. Greetings to everyone.
Great. I have with me Professor Saira Afzal, Dean of Public Health and Preventive Medicine from Pakistan. She is from the King Edward Medical University, Lahore. Welcome, Professor Afzal, to the show. It's an absolute pleasure to have you.
Okay. Hello, my pleasure.
Absolutely. I think we'll be having a lot of inputs from you on Pakistan. We are also having Dr. Harshvardhan Puri, to be precise, is a consultant institute of chest surgery, Medanta Hospital from Gurugram, and also part of the Lung Foundation, and actually working right there to save lives at this point of time, literally. And I really feel that we have taken 1 hour from the patients, but I think this 1 hour should be beneficial for many people. So welcome, Professor Harshvardhan, to the show.
Thank you. Thanks a lot. Pleasure.
Absolute pleasure to have you. And finally, last but not the least, I think extremely important and perhaps out of this regional mix is Dr. Pallavi Pant. Dr. Pallavi Pant is a scientist from the Health Effects Institute, and really would like to understand this macro levels health impact and the relationship between air pollution and this COVID in a macro scale, but to be precisely on South Asia. I don't want to kind of spend much time on that. Let me go directly to Dr. Harshvardhan Puri. But before that, let me reel out very quickly some data. The COVID situation at this point of time, when we are sitting here, is that India, in South Asia, India is having about 19.2 million patients, and the number of deaths so far from COVID is 212,000. That is 0.2 million deaths is there. In Pakistan, we are having 0.8 million cases. I am going through the WHO data, so please correct me if I'm wrong. 0.8 million with 17,680 deaths. From Bangladesh, again 0.8 million, but 11,393 deaths, and also Nepal and all. So that's a very critical situation. So let's go straight to Dr. Puri. Dr. Puri, we are hearing that people are dying without oxygen. And I think you are also facing the same today. A tweet by our External Affairs Minister about a former ambassador being dead, I think in your hospital only, because he couldn't get oxygen. So please let us know what exactly the situation is.
The situation here in Delhi and NCR, in almost whole of the Southeast Asia, is very bad. We are facing it right on our faces. The COVID situation is getting out of hands. Now, the problem here is that the second wave of COVID, it is almost an unprotected wave. The magnitude of this wave has swept away all the medical facilities, doctors, and everything. There are two things which I want to share with the panel here, that there is a lot of difference between the first wave of COVID and the second wave of COVID we are facing. The infectivity of the virus this time is much higher than the infectivity of the first wave. The other thing is that the mortality in percentage is quite lower. Like the mortality in the first wave was something like 3%, and the mortality is 1.8% in the second wave, which we are seeing. But because of the sheer number of people it is infecting, the absolute number of mortality is increasing like anything.
The gross number is increasing.
The gross number is increasing like anything. And the whole of the medical system is almost on the verge of a collapse. This collapse is because the oxygen required in the areas of India or places like Delhi and all those, the oxygen supply of whole of the country is good enough. They have a good corpus of oxygen, but the reaching of oxygen from those plants to Delhi is getting difficult. So almost the whole of the city is choking. The hospitals are choking now. 2 hours before, one of the bigger hospital like Batra Hospital, the oxygen went off and we lost 12 patients there. One of a senior doctor was also admitted. So you can imagine the fact that it is not the common man or the middle grade or the higher grade man. Everybody is suffering the brunt of this disease now.
Dr. Puri, sorry to interrupt you. I don't want to get into the politics in this particular program, but
yes,
I really would like to know from all of you that when we are talking about an economy, which is one of the biggest in the world, when we are talking about an economy which aspires to be a 5 trillion economy, and we are talking in 2021 that we don't have oxygen, we don't have oxygen plants, that's a bit of a criminal to me.
Definitely. I'll agree to it. I don't want to get into politics of who did it, why it was done.
Absolutely.
But the medical facilities, medical structure in the country at the moment is in shambles. We are going for a war footage fight against this virus, and still it's looking like we are losing the battle. I feel helpless when we see patients in front of us dying.
Hearing from you, if you say that we are losing the battle, then what the patients who are looking towards will feel. I think that's extremely, I think, situation which is, I think it's really, really bad. So we'll come back to you, Dr. Puri, trying to understand that whether you are finding the patients with compromised lungs are being more affected, so air pollution playing a critical role or not. But very quickly, I try to understand the situation from others about the COVID situation before I kind of trying to link with the air pollution part of it. Professor Dashgupta, as we had started talking about India, very quickly, where does India stand now? Dr. Puri, as a physician, talked about the Delhi's actual live situation, but what about the whole country?
Dr. Puri made a very, very important point. And with your permission, can I quickly project 2 slides and take about 3 minutes to explain, or rather to reinforce what he said?
I think if you discuss, that will be better, because the format is like that. It's
okay,
better
fair
to
enough.
Kind of talk.
Fair enough. The reason I said slides is because it contains certain figures. That's okay. I'll quickly explain what actually explains, rather, what bears out what Dr. Puri said. Dr. Puri said 2 very important things. One is the issue of numbers. Why so large numbers? And he also said a very important thing, that actually the mortality rate is low. Mm-hmm. Now, this is both good news and a bad news, and I shall explain why. Now, what has really driven this second wave? The second wave is driven largely by 2 mutant forms: the UK mutant form, which was first picked up in December. This largely contributed to the surge in Punjab through February, March. The other is the B1617 mutant, which was picked up early enough in Maharashtra, which drove the surge in Maharashtra through February and March. And why these two states are important is because till 31st March, these two states contributed anything between 75 to 80% of the country's new cases. And what we see in Delhi NCR today, which is really the eye of the storm, so to say, is most probably, and there is some evidence of it, of this region being affected by multiple mutant forms. Now, both these and the UK variant was certainly known to be anything between 30 to 70% more transmissible than the earlier form. And there is evidence that the B1617, or the so-called double mutant, but it's not a term to be encouraged, the B1617 is at least equally transmissible as the UK variant. Now, what it means when something is more transmissible and less fatal, which is what exactly Dr. Puri is saying from his clinical experience. So it's a simple epidemiological math. I'll just read it out. So if 10,000 people are infected in a city, and each infects 1.1 other people on average, and this computation comes from another source, from someone in the London School of Hygiene. So he is drawing upon the UK rates, known UK rates. So I'll read it again. So if 100,000 people are infected in a city and each infects 1.1 other people on average, which is the low end for the estimated rate of infection in England, then in 1 month, 16,000 people would be infected. And at a fatality rate of 0.8%, which was the fatality rate in England, and which you will agree is pretty low, this 10,000 people ultimately ends up in 16,000 people and then 128 deaths. Okay. Remember this 120, I'll just take 1 minute. Remember this 128 figure. Now, if the variant is more deadly, this becomes 192 deaths, which is roughly double. But if the variant is 50% more transmissible, though no more deadly, this becomes 122,000 cases in a month and 976 deaths, which is 10 times the deaths, which is a whole lot of preventable deaths. And that's what we are exactly seeing. And half a minute more. Was this known or was this not known? Was this predicted or not? I would draw your attention to a Reuters report that's broken today, which simply says, scientists say India government ignored warnings amid coronavirus.
Absolutely.
So this is what explains what's happening in the last.
Absolutely. I think I'll come. We'll discuss that.
Time.
But let me very quickly. We have heard the kind of a scary situation in India from both the experts. But let's go to Bangladesh. Professor Amanullah, what's the situation of COVID in Bangladesh right now? What exactly is the situation? How you see it?
Thank you very much. Bangladesh is currently is 3 weeks lockdown is going on in Bangladesh, and before the lockdown, around 3 weeks ago, the infection rate was around 24-25%, and because of 3 weeks lockdown, we see today around the infection rate is going down and it's around 9.6%. So it's not a strict lockdown, but lockdown works. It means the lockdown works, and we reduce the infection rate from 24% to 9.6%. That is the one thing.
The sample size is okay. The sample size is okay, or it should be bigger. What do you feel?
No, the sample size is not okay. The studies done by ICDDRB and the projection by international experts says the number could be 5 to 10 times more. One of the studies conducted by the ICDDRB, they found around 60% slum people in Dhaka city, they are infected with COVID. But surprisingly, they are so asymptomatic and they don't go to hospital. Hospitalization is not needed for them. And the death rate is much, much lower among the slum and the poor people of Dhaka city. So currently, The situation of Dhaka city looks like control, like the oxygen situation is okay. The COVID bed around the hospitals, there are some the COVID beds are there, and at the same time the ICU management is also controlled. But the point is that the air pollution level in Dhaka city is one of the highest in the world, as
We'll
you
be
know.
coming to that. That's extremely important.
Like Delhi. The thing is that the way you know the festive season is coming, Eid is coming after 10 days. The way people started moving to the other parts of the country, and at the same time, the way the shopping malls and other places are open and the public transports are open, and people are idiosyncratic, and people the perceived susceptibility is less among
No,
the
that's
general
beyond
people.
Dhaka. That's beyond Dhaka.
Beyond and within Dhaka,
But
beyond
Dhaka is
and within,
lockdown is going on now in Dhaka.
lockdown is going on, but the movement is serious. Movement is there.
But the shopping malls and shops are they open?
They're open because of the pressure, of the shopping mall owners, because of the pressure of the other businessmen. The government had to open the all those. So
It's a compromise.
it is a surprise. It is a surprise for Bangladesh. It is a surprise for Bangladesh. Despite opening everything, the infection rate is still around 10%. The numbers
I hope the data is okay. I hope the data is okay.
But if you ask me the question, there are lies and deceptions are always there during the time of COVID. The lies and deceptions are always there during the time of COVID. There is a question mark about the government statistics.
Okay.
It could be 5 to 10 times more.
Okay. Let me go to Pakistan. Professor Afzal, how is the situation in Pakistan?
Yes, in Pakistan, currently we are in the third wave, and this third wave is much different from the first two waves that we have witnessed before. In the first wave, we are able to control by certain important interventions. I would discuss them later on. What was our smart lockdown that has been very successful, home quarantine, home isolation policies that have been very successful. Moreover, we have certain other policies that led to the decrease in the first and second wave, like schools and every institutions, they were closed, and the economy that has also been balanced out. So there was an economy that has been generated. At the same time, the smart lockdown that has been implemented. So as you have said that the figures are the total cases were more than 800,000 in Pakistan. Most of the cases were in Punjab. And as Punjab is one of the most populated province of Pakistan, so we have more than 303,000 patients that were in Punjab only. When I talk about these cities, it is not the phenomena of the rural areas. So whatever we talk about COVID, we always say that the COVID is hitting the urban areas much harder than the rural areas. It is the disease that is believed to be of the old age, but in third wave, we have seen that even the young people, they are getting the disease. Even the children, they have been admitted, and some of the children were especially presented with post-COVID syndrome that is just like Kawasaki syndrome. They have red eyes, they have ulcers, and they have certain other features that were not found in the first and second wave. So there is a phenomena of mutation. I totally agree with the rest of the people.
Just a quick supplementary question. You were talking about the third wave. How it qualifies in comparison to the second wave? Is it a bigger wave or is it a smaller wave? How it is? In India, we are currently having so-called second wave. Professor Dasgupta, am I right? We are now having the second wave. So we are having a much bigger spike than the first wave.
We are right, and Professor Afzal is absolutely right. The the Pakistan situation, particularly in the Punjab, was driven by the UK variant.
Okay, so let me go back to Professor Afzal. So you are having third wave right now, as you were saying. So your third wave is compared to the second wave. Is it a steeper spike or is it a smaller spike? What do you feel?
No, it is as compared to the second wave, it is steeper. However, when we compare it with the first wave, it is approaching the first wave as it was having the highest toll of the deaths were in the first wave.
Okay.
Our CFR is about 2.18 for Pakistan and 2.8 for Punjab. And in Punjab, for certain cities, there is more deaths that have been reported from those cities.
Okay, fine. I think we'll be trying to understand from you later the kind of whether the polluted cities are being more impacted. But let me first, now we have talked about the COVID a bit. Now let us try to understand the air pollution component. And can I start with Anumita? Anumita, as because we have started with the Delhi, I'm trying to get the full cycle in that order. Anumita, what do you feel that in India, Delhi, the NCR region, the UP are the most polluted region? They are having the more polluted cities. And now we are finding they're the most affected, apart from Maharashtra and other cities definitely are there. So what's your kind of understanding, Anumita?
So, Joyinto, first of all, we have just heard from Dr. Puri and Dr. Dashgupta the changing pattern of the pandemic. And while trying to understand that, so there is the whole, the medical side of the story. But the other changing pattern that we're beginning to see today, and that's what I would like to link with the issue of air pollution, is the spread of the disease across landscape. So during the first phase, and I just want to hint at that during first phase, we talked more about the cities where we got the incoming cases like Mumbai, Delhi, Bangalore, and then the migrants moving to Uttar Pradesh and Bihar and West Bengal. That was the nature of the spread.
Absolutely.
But in the second phase, it's a lot more widespread. And this kind of the landscape that is, and we're constantly broadening and widening. Now, this also means that we are beginning to notice resurgence of this in different micro environments, in different air pollution situations, and with huge vulnerability. Now we know that India as a whole and South Asia, it's now called the epicenter of the global air pollution problem. And we know that 90% of the population in this region don't breathe air that meets WHO guideline. And Pallavi will tell you more of this from the state of global air.
Absolutely.
But we know that this region also has the highest exposure, and it has also experienced one of the steepest increase over the years. And what that report is also telling us, that even after moderate improvement in the levels in the region, it's still is the highest if you compare the different regions of the world. And today we are talking about even highest number of deaths among children and babies in this part of the world. We are also talking about multi-pollutant crisis. It's just not the tiny particles, but also ozone, all of that coming together. And therefore, now within that context, the point that I want to raise today, that Delhi NCR, larger Indo-Gangetic plain, which we know are highly polluted. But we also have Kerala today, we have Maharashtra today, right? And we have to understand that it is just not the high levels in Indo-Gangetic plain, but what we breathe in other regions of the country are also not safe. So this complacency that is breeding in this country, that, in Mumbai or in Chennai or in Kerala, I'm not, we are safe compared to the Indo-Gangetic plain, that myth has to go today. And I just want to end with one point, that in this shifting nature of the change, just keep in mind our vulnerability, that both air pollution and this pandemic happening when we have high level of comorbidity, high incidence of poverty, large number of poor people, and also new poor because the economy has collapsed. So imagine this additive effect of all these factors, how much that is enhancing the risk.
I think Anumita has made an extremely important point that sometimes in media, we tend to go overboard with a Delhi or a Kolkata going a record air pollution, almost getting a bit of a sadistic pleasure in reporting them. But at the same time, other parts of the country, which may be less than that, but are above the normal, as Anumita pointing out, and that impact is now being felt. that even these people in Kerala and Maharashtra are not that safe because they are also having the compromised lungs. Before I go to Pallavi, to understand this macro relationship, very quickly from Professor Salam, what's in Bangladesh? Do you feel this linkage of pollution and pandemic?
Thank you, Jayant Bashum, and expert, the panelists today. Actually, I learned a lot about the whole situation in IGP region. Actually, if you want to tell about the air pollution, for actually in environmental pollution, Bangladesh is the #1 country for the worst environment and the highest number of deaths for environment. And air pollution is the #1.
Bangladesh #1, Pakistan #2, and India #3.
Yeah, exactly.
For record.
And most of the cities, if you go for most of the cities in this region, in Southeast Asia, is more specifically IGP, Indo-Gangetic region, we have highest number of PM 2.5, highest smoke, and highest ozone pollution, and all the pollutions are highest. So what happened actually in this region, the people, already Anumita mentioned that the whole region people, they are all the important organ already compromised with the high exposure of air pollution. This is not the only situation. I think in this area, all over the world also, 90% people all over the world don't have clean air. What is prescribed by WHO, 25 microgram per meter cube. So 90% city people in the world, they inhale very poor quality of air. So
absolutely, I think I think you are almost kind of feeding to Pallavi, because I think the point that you have just raised, I think, is feeding to Pallavi. Let me, I'm coming back to you, but at that point, because it's a very important point you have raised, Pallavi, what do you feel? Professor Salam just said that not only South Asia, India, Pakistan, Bangladesh, 90% of the people in the whole world are not having the clean air. So what's your assessment, Pallavi?
No, I think he's very right. Over the years, we've seen data from across the world, and air pollution levels, including PM 2.5, as Anumita was saying, and then as both Anumita and Dr. Salam said, not just PM 2.5, but also ozone, other gases like nitrogen dioxide are very high in many parts of the world. And if we just think about this disease, as Dr. Harshvardhan said, and as Dr. Afzal and Dr. Rajid said, we know that the disease affects our lungs. We can sort of inhale it, get exposed to it in different ways. And if we have already been living in areas with high pollution, PM 2.5 is linked to respiratory diseases, heart diseases, ozone exposure linked to respiratory diseases. So for years, many people have been exposed to high levels of air pollution. Your respiratory systems are not as solid, for the lack of a better word. People have diseases, people often have breathing difficulties even without COVID. So when a disease like that would strike you and it is going to impact your respiratory system, then you will be less likely or more vulnerable to it, more susceptible to it. And that is something we have also seen in other parts of the world. That's not just true in South Asia. I think in South Asia, the reason it becomes such a big important sort of factor is because our population levels are very high, and most, if not all, are living in areas with high air pollution. Not just in urban areas. Just think for a minute about parts of Pakistan and India, Nepal, Bangladesh, where we have crop burning, and there are villages where people get exposed to that smoke. People use wood and charcoal and other things to cook food. Even the migrants, as they were going home from different places, that's what they were doing. So we are continuing to see those exposures, and there's a lot of data and numbers that are coming out now relating COVID to air pollution. But even if we go back to the basics of what is air pollution impacting in our body, it's our lungs, it's other organs and systems. And what is COVID impacting? It is the same systems, the lungs, our respiratory, breathing. So that's how we link.
That's impacting. Any study being carried out by Health Effect Institute so far linking the COVID and air pollution? Any study which has been published or something? Any data which has come up from any part of the world, South Asia in particular? Anything of that sort?
there have been a number of studies. I think air pollution scientists in different regions have been looking at this. From South Asia in particular, there haven't been, health and air pollution studies as such. There are some going on right now, and hopefully we'll hear about them. But in Europe, in China, and in US, there have been studies which have shown people who live in more polluted areas have a higher risk of having a more severe case of COVID if they get the infection, or higher chance of death if they get infected with COVID. So there is that difference. You might get infected, but whether it's severe
So
or
Pallavi, sorry to interrupt you. This is not a theoretical
Mhm.
question anymore. This is not a theoretical question anymore. The
Mhm.
relationship
No,
between
it's
the
not.
pandemic and
Yeah.
pollution has been kind of established to a large extent.
Yeah.
So
I
with
yeah, I
that
just
context, Dr.
I
Amanullah,
just
you were
want
trying to.
yeah, I just want to add one thing. There are dozens of studies already completed, and
Mhm.
there are journals. There are articles in the British Medical Journal. There are articles in the Nature PLOS One. There is a relationship between the COVID infection and the air quality of air pollution. But it is hardly noticeable any study in Bangladesh or in I saw in a couple of studies in India, but not seen anything for Bangladesh or Pakistan. But
Okay,
there are
you may
established
be
facts.
having studies, Professor Amanullah, but those study result, I'm afraid, is yet to impact the policy decision of the government. That's where I'm coming. That's where I'm
Not
driving
at
at
all.
actually.
Not at all. Not at all.
Not at all.
I
I'll
also
be coming
want
to
to add
that.
one
But
thing.
let me first go to Dr. Harshvardhan Puri again, before from the macro to micro. So the experts are talking about the macro situation, linking the studies, linking pandemic with pollution. But when you are seeing a patient, maybe a patient whom you have been treating long for some lung ailments, are you finding the patients with the compromised lungs, maybe within that comorbidity group, are being more vulnerable to the COVID spread?
So I'll be telling you, I'll take two or 3 minutes. I'll be telling you three situations here.
Okay.
When the COVID was not there last 2 years back, and there was a small thesis one of our PGs did, in which we saw the demography of the lung cancer patients presenting to us. So what we saw was that the lung cancer patients 10 or 20 years back were much older. They were all smokers. They were all smoking cigarettes and all those stuff. And the women population was around 1% or something, 1 or 2%. And mostly 90-95% was males and 5% females or something like that. So what we saw the shift in 2018 was that we have a something like 60-40 ratio of women is to men, and men is to women, and the younger patients like 20 to 25 age group was increasing, and like 10 to 15% of the population coming to us with lung cancer was a non-smoker. They were the people who hadn't
Mhm.
smoked a single cigarette in their life. So what was it which was causing this shift? So only thing which we could correlate as clinicians, we are not epidemiologists, we don't do studies. As clinicians, only one thing which we were able to correlate it to was air pollution. Now, it doesn't take an Einstein's brain to think that how would it would have happened. Basically, what has happened is, am I audible?
Yes, you are
Yeah.
audible.
Yes,
So,
yes, yes.
what has happened is the only thing which has changed in the last 20 years, except for the cigarette as being the most common factor in lung cancer, was pollution. This was one aspect pre-COVID. Now, what
During COVID.
experts, yes, what
Mhm.
experts are talking about, this pollution, when we went into the depth of it, the PM 2.5, PM 10, and PM 1, we saw that this polluting particles cross the blood placental barrier, they cross the blood-brain barrier, and almost affect every organ of the body. Include the most affected is the lung, then the neurological system, the
Mhm.
cardiovascular system, the muscles, everything in your body, your eyesight, your obesity is being related to pollution now. So we can see that every organ of the body is affected by pollution. So if it happens, if it is there, we know it as, we keep it as situation A. And now we take COVID as a contagion or as a pathogen. Now, viral disease like COVID, what it does is the most of the effect of this viral viremia is on the lungs. and then it turns into a multi-organ failure inside the ICUs, which we see where we have involvement of the kidneys and the liver. Mostly it causes multi-organ failure with hepatotoxicity, the renal failure and all the stuff. So if we are knowing that the patient is already suffering from the burnt of pollution, he's already having the compromised lung functions, compromised kidney functions, which is proven by many studies because of the pollution. The people will get more affected by COVID.
So basically what you were saying from your experience, that the people who are having compromised lungs are being more impacted, more quickly impacted, and being actually more vulnerable overall.
Yes.
I think extremely important from a person who has been treating them right on the hospital bed. Let me very quickly, Anumita, interesting point, but also the counterpoint may be that are we seeing a different pattern maybe in the areas which are not being all that polluted? Anumita, what's your take on that? Say in West Bengal, Sundarbans, or for that matter, areas which are far away from this bustling and hustling cities. Is it different? I would like to know also from Bangladesh and Pakistan, but quickly, Anumita, what's your point?
So, Join, to give something conclusive on this, someone really has to do the study here, which really hasn't happened. The only study that I've seen from World Bank that came out in February 2021, and that is for the country as a whole, where they are saying that there is a causal effect in India between the long-term exposure to PM 2.5 and COVID-19 deaths. In fact, that study has said that 1% increase in long-term exposure to PM 2.5 leads to an increase in COVID-19 deaths by almost 5.7% and fatality by yet another 0.027%, something like that. But of course, they're also saying that this will have to be linked with underlying health conditions and other respiratory illness which are affected by air pollution. So that's the only study that I've seen in India. So at this moment, we do not have information like they have done. So therefore, the first spatial study we have seen, actually the first SARS pandemic that had happened in 2003 in China, where they had shown the spatial difference. After that, now we have seen that in the US, in Italy, even new studies have happened in Europe, where they are showing that you actually are seeing a higher impact of COVID in regions with higher level of pollution. In fact, the US, the Harvard study is talking about 8% more likely death from COVID than in areas with lower pollution.
Okay, but do you think that a larger study is required?
But one thing that I just want to tell you, that all these studies are pointing towards one very important fact, that scientists are today kind of agreeing that improving air quality may play an important role in overcoming or at least reducing the impacts of the pandemic. You know, that's an interesting conclusion.
That is, I think, extremely important. And I think let's open up the Pandora's box.
And just keep one thing in mind for South Asia, that all the studies that I've just cited for Europe and US, there you are talking about moderate level of pollution. It's not the same kind of pollution that we see in our part of the world. So we really
just a naive question to all the experts out here. Does the particulate matter, for the PM 2.5, we know that PM 2.5 carries a lot of carcinogenic metals and everything into our system. Does it have a role in transmitting the virus? Any lead or any study on that? Anybody from the panel can throw some light on this?
I'm supporting Anumita because you see in Bangladesh, the COVID is concentrated surrounding Dhaka, Narayanganj, Chittagong, the port city, and Sylhet. Most of the migrants people are from Sylhet. The other divisions and other areas, the infection rates are minimum 4 to 5 times less than the city area. That is one thing. The second thing I'm supporting, and I'm constructing a hypothesis in supporting of the Anumita and others, because of the lockdown, we have the industrial disasters, we have the development disaster, and we have the transport disaster in our urban areas, especially in Dhaka. Lots of films from the transport, lots of the development works are going on, and lots of dust in there. So due to lockdown, for the last 3 weeks lockdown, the infection rate from 24%, it came down to 9.6% because of the clean air, because of the clean
So
air.
you feel that air pollution has a role in that case? Air pollution has a role in that case?
But there are no studies here. There are no studies here.
Okay.
There are studies in the, what Anumita said, in the other countries, including Australia. One thing, including Australia.
I want to add things from Pakistan.
Before I go over to that next issue, very quickly to Pallavi, very quickly, we are having about 20 minutes time. That any relationship between the particulate matter and the virus being established so far?
Yeah, there have been some studies, but I think, you know, not as conclusive in terms of whether the particles are transmitting. But one thing which is critical also with the air quality discussion is that since the virus can be transmitted by air, can spread by air, indoor air quality and ventilation are very important things that we are not hearing as much about in South Asia. And I think we need more discussion on how to reduce the spread of the infection by focusing on air quality inside homes, offices, shops, you know, all of those places. So very quick mention of that.
Okay. I think that's another very important point. Very quickly to the Pakistan perspective. Yes. What's your position? I think your position is also the similar, that the polluted cities are more impacted. I think somebody's mobile is being switched on, so that's, I think, please take care of the mobile because it's giving some signals. Anyway, what's your point?
Okay, from Pakistan, yes, there are various studies that have been published about the air pollution and the relation of COVID-19 from King Edward Medical University and from Lahore University of Management Sciences. It has been published. What is the mechanism? As you have said, that particulate matter, when it enters in the respiratory tract, there are mucous membrane, and on the mucous membrane, there are thin hair-like structures that are called cilia. These cilia, they are used to engage that particulate matter so that it cannot go down into the lungs. Once the virus is present on these particulate matters, those cilia, they can't work properly. So the virus has more chances to reach the lungs directly and causes pneumonia. And that pneumonia is causing mortality. So there is a very strong relationship of the particulate matter with having that virus being lodged on it and going directly to the lungs and causing a severe pneumonia and mortality. And in our study, we have found that 8% more mortality was found in those areas where particulate matter was more. And even 1 microgram per meter cube in air pollution that was measured by PM has increased the mortality. Another thing that I have already told you is the rural areas are not very much affected by COVID-19 in Pakistan. It is one of the indirect evidence, because in our rural areas, there is a lot of good air that is present, and there is very little industry and vehicles and brick plants and pollution. So rural areas, they are not
that much affected.
Okay, my third point is, we know that Lahore is among those 10 cities that are affected by pollution. And when we see in Punjab, Lahore has the highest positive.
Yes, Lahore is extremely polluted in the global list. I think your voice is trailed off. Anyway, we heard you that Lahore is one of the most polluted cities. Very quickly to Professor Dashgupta, it's very clear from hearing all these environmental experts across South Asia and also Pallavi from Health Effect Institute, that pollution is causing or triggering or enhancing the impact. Now this, you were talking about the variant, that UK variant and also the double mutant variant in India. I don't know that double mutant variant is operating in Bangladesh or Pakistan.
It's in Bangladesh. It's in Bangladesh.
It's also in Bangladesh. Now, many public health experts told me, and I actually have written on it, that this double mutant is kind of crossing the barrier in the nasopharyngeal region much too quickly and colonizing into the lungs. So that's again adding to the problem. So, Professor Dashgupta, how you see it?
I don't know. I am no expert on air pollution and health. But yes, from a clinical epidemiology point of view, this observation has gained credence. It is perhaps the case that it's involving the lungs earlier. But then again, these are evolving scenarios. I have no knowledge or expertise to be able to link it in any way to air pollution.
Okay,
Yeah.
fine,
I
fair enough.
think
I think we are having about 10 12 minutes time. Let me start with Pallavi. I think this round is about the policy part of it, because even before COVID, I had the opportunity to kind of interact very closely with the WHO head on air pollution during the Madrid COP and other COPs as well, where he said that despite our repeated requests, many countries, including India, are not very inclined to take the air pollution control as a policy measure in a very progressive or a proactive way. So that was before COVID, and now COVID has added to that. Pallavi, how you see the policy response of the countries like India, Bangladesh, Pakistan, despite being the most polluted cities in the world, most polluted countries in the world, are they doing enough on the pollution count? COVID or no
yeah,
COVID?
I think that's an important question that we can maybe spend a whole hour on. Just to put things a little bit in perspective, I think over the last 10 or so years that at least I've been working in this field, there has been progress. So I wouldn't say that countries are doing nothing. Are they doing enough? Is a good question to ask, because there definitely are things that we could be doing today if we have enough data and information. And this is not just true for India, this is also true for South Asia as a whole. And there have also been instances where there are now increasingly demand or asks for whether countries across this region can work together, because the air in India, Pakistan, Nepal, Bangladesh, it's all very similar. Our sources are very similar. And I think that in terms of policy action, one major takeaway that we should hopefully be taking from the COVID crisis is that air pollution is a health issue very centrally, and our public health planning, not just air quality management, but our
Absolutely.
public health planning needs to consider it as a way of as a sort of factor that is impacting health. And in the long term, our health policies need to acknowledge air pollution. One additional point I just want to make really quickly in terms of the link between pollution and cities and sort of rural areas is also that there is this link between pollution and COVID. But
Okay.
let's also remember that there are other factors like population density, which vary a lot.
Yes, that's very
So there is
important.
correlation, but let's not jump that this is causation necessarily. I'm
Exactly.
not denying that there isn't a link, but it's not the only factor that could be
Yes.
driving these differences.
It's not really a
I'll
one is to
stop
one.
there.
It's not really a one is to one relationship. It's not really a one. Much more complicated to that. Let me go by the ranking. Bangladesh is the most polluted country. So I'm starting with Abdul Salam sir. Do you feel that your government is doing enough on the air pollution control policy, COVID or no COVID? Now COVID is added to the emergency part of it. Professor Salam?
Thank you, Jantuda. Before that, I have something to previous section. Professor Amanullah
Very quickly, because
mentioned.
we have to wind up by another
Okay,
7-8 minutes.
yes, I'm going very quickly. There are some studies in Bangladesh also between the relation of air quality and COVID-19 deaths,
Okay,
and it's
very important.
well correlated. This is one thing. Another thing I would like to mention, all of our discussion, our panelists mentioned here, there is this strong relationship between air pollution and COVID. But I believe there may be some points or some optimum condition. It's not directly related. Professor Amanullah mentioned most of our Salam people, they don't have any mortality. They have COVID patient, they have COVID carrier, but they don't have any mortality because they have a strong capacity to overcome the COVID-19, though they are very poor living condition with very poor air quality, but they are not, there is not enough mortality. Maybe we should consider that one. They may overcome the situation because
I think
they already
just hold for a second. In fact, I just triggered because Professor Salam Sahib is saying it. There's a theory going on in India, in Kolkata, in Delhi. I don't know, Anumita can tell that the slum people, the people who are in the socioeconomically more challenged, they are being less impacted by the COVID. That's the general theory,
yes.
And they are being kind of, that's what Professor Salam is just saying. I think it merits another day to discuss, but that's a fascinating point because I don't know. Then it's now at least world has come to a place when being poor gives you some
Yeah,
dividend. At least till now it was not.
Okay.
Till now it was not.
Okay, maybe I can finish my second point. I can finish
Sure,
my second
quickly.
point. You mentioned about the policy thing. Yes, there is not enough policy intervention. That's why our pollution increasing day by day. But there are a lot of steps going on to control air pollution, not only in Bangladesh, in the whole region, in IGP.
Whole region.
Through there is, the Mali Declaration is working, World Bank is working, and UNDP also working to combat the air pollution in whole IGP. In winter haze, it's comes
But
from
Professor Salam, this is my kind of point, and not to the Professor Salam, to all of you, that World Bank or other institutes, they can only kind of cajole you, guide you to form the policy. But end of the day, your government has to implement it. Your politicians have to implement it. So that's where the gap is.
Yes,
yes.
Okay, I just 1 minute. Then I think to control the air pollution, the whole IGP region, we have a strong relation. I think Pallavi mentioned that our pollution sources are same, and we need similar kind of approach to control air pollution. But we need another things. There is a huge transboundary air pollution. From one country's pollution is coming another country. So definitely they need a regional cooperation to control the air pollution.
You are saying that we are not giving you Tista water, but we are giving you air pollution.
Yeah, in some cases, if you consider it winter time, all the pollution from India and China is coming over
Okay, great.
Nepal, then Bangladesh, then Bay of Bengal.
Absolutely, I completely agree with the transboundary theory. I think we have been talking about it.
Coming back the back way.
Okay, Amanullah Sahib would like to add something. Amanullah Sahib would like to add something on the policy issue very quickly.
I just want to tell you, for the last 4 or 5 decades, we developed so many policies, environmental policies, climate change policies within the country. But it is because of the neoliberal economy, it is because of the capitalistic economy, as everybody knows. It is because of the pressure from the industrialists. It is because of the pressure from the urban elites. It is almost impossible to implement the policies by the government. That's why the government always says that we have to do this, we have to do that, and government is positive in terms of controlling the air pollution. But in reality, in the field,
not really
they can't do anything. They can't do anything.
Okay.
They can't do anything. We don't know how to do it.
This is a very complicated situation. Very quickly to Pakistan. Very quickly, just having, I am just extending my 5 minutes just to have the all views from Pakistan. Your policy.
In Pakistan, as we say that journey of 1,000 miles start from a single step. So in Pakistan, we have 2 important policies. One is the Green Pakistan policy initiative by the government of Pakistan to make a green tsunami where more than 1 billion trees has to be planted. And we in every campus of the university, college, the students are involved in having plantations. The second is CPAC. That is a very important another policy that has yet has to be implemented, but it is in papers now. So we have 2 policies to control brick lanes, vehicles, and all emissions, etc.
Okay, the challenge is how can we transform the policy from the paper to practice? That's what the challenge is. Let's go to the India now. 3rd in rank, Anumita. What do you feel Indian government's policy on? We have NCAP and everything, but do you feel that's really working on ground, Anumita?
First of all, Joyanto, we have to recognize today, and as an air pollution quality community today, all of us fighting for clean air, that where we have failed miserably. And keep in mind the fact that year after year, we are getting the data from Global Burden of Disease and other studies telling us that 1.2 million people die every year in our country because of related deaths. And these are largely cardiovascular diseases, right? And yet, never ever we asked our government and the health system that what is the health sector preparedness to deal with that burden of disease. If we had asked that question, then we would not have been fighting the pandemic the way we are fighting it today. All the statistics that Dr. Dashgupta gave today, each and every number there is a personal story. And therefore, today when I'm going to talk about the mitigation, I'm going to start with the health ministry and not with the environment ministry. And I will say that health ministry has to strengthen its own health system response to air pollution challenge. Health-based criteria has to be part of the decision-making process. Health information, in fact, we need health impact assessment of regulations and health cost benefits to guide all our mitigation strategy. And health and ministry has to respond to all the epidemiological, toxicological, scientific research to bring strength to the air pollution solutions.
In fact,
and we need, and then we need the exposure assessment, health impact assessment to inform policies. But after that, I'm going to say that after fixing this health sector and alongside, then we are going to say that the National Clean Air Program on India now today requires a teeth. And we need to hold everyone liable and accountable in each and every airshed of India, so that we meet the clean air targets. We have the multi-sector action for clean energy transition, sustainable mobility, waste minimization, and at the same time,
accountability has to come. Accountability has to come. But Anumita, unfortunately, when the ministers and the senior officials challenge the figures being generated, so the mindset is that I'm going to challenge it. I really would like to counter that. Then this issue of action goes into the back burner a bit. Before I kind of conclude, before I conclude with Dr. Harshvardhan, but before that to Professor Dasgupta, very quickly. Professor Dasgupta, as a public health expert, very quickly, 30 seconds, do you feel that the issue of air pollution being ever considered within the wider fold of public health, or has it been left out? Professor Dasgupta.
Oh, it has been left out, and what Anumita said is absolutely correct, and I fully agree with her. Nothing to add, in fact.
I think it can't be anything more crisper and more kind of...
Same in Bangladesh.
And I believe same in Pakistan as well. Pallavi is smiling. She knows that it's happening all across South Asia. Let me conclude with Dr. Puri. Dr. Puri, having heard and all these things, do you feel as a doctor, because just now Anumita, I think it's a very emotional way she said that what Professor Dasgupta is saying, the number, there's a story behind each and every number. When somebody is dying, we are saying 59, 58, but when we're talking about the millions of deaths in air pollution, as because every morning in the paper we don't see that number, we are not bothered. Today we are seeing the number of the COVID kind of date and the dashboard saying that this number of deaths, this number of being affected. We are so bothered, but much more than that, being affected and being killed by air pollution, but we don't care. So how, as a doctor, you want your government to do proactively on that?
3 points, concluding points from my side. What you are saying as a number, they are the patients dying in our hands. So what is a number for epidemiologists? They are the people dying in our hands. That's the one thing. The other, the public health spending or the government spending on this pandemic has done what it should have done. That it has, the system hasn't collapsed. The system was already collapsed. It has shown you the face of the system, that your system is collapsed. If it gets overburdened by any of the pandemics, you're gone. The second thing. And third thing, till the time we do studies to find a cause and effect relationship between these contagions and the disease, I think half of the population would have already died. So it is a time to act is now. We have to make policies. We have to give something to our children. We can't let them die on the roads like this, what has happened to Delhi, Bangladesh, Pakistan at the moment. So it's my request to all the epidemiologists here. We have the figures, we have the AQI levels of each city. Please do a study as soon as possible and pressurize these policy makers to do something on ground and increase the health sector budget or public health spendings and doing whatever they have to do, because people
save
are really,
lives,
dying on the roads. Yes,
very emotional appeal from somebody who is there, right there. Pallavi, I really thought about ending with him, but as because he raised that issue, one-liner from Pallavi, that how really you would like to turn this number into stories and the stories into number, how we can stop this cycle being happening again and again, what we can do about it.
I think we need to remember everything that everyone said here, and also as the air quality community, as Anumita was also saying, bringing together health scientists, clinicians, public health experts and policymakers together, not working in our silos, but all of us coming together to address this problem that's killing, many among us, our family and our
And
friends. So
push
that
the
would
government, push the governments to actually act
Absolutely.
on ground. The so-called
Yes.
studies, the so-called reports,
Absolutely.
which are going to the back burner, never being acted on. And we find that the actions which are being taken are anti-pollution, anti-environment.
Yes.
So that doesn't work. So I think with that, I think it's we did a fantastic panel and we had a fantastic discussion. I believe you have all enjoyed it. But more than the enjoyment, I believe people are dying. People are dying all over the world. People are dying in South Asia. The person like Dr. Puri, seeing them being dead in front of him. And we find now, I think you have all agreed that it's enhanced air pollution is contributing to that. I completely agree, Dr. Pant, that there is no one-to-one relationship. It's a complicated one, but definitely air pollution is contributing to the upsurge of corona. So sooner our politicians, sooner our ministers, sooner our decision makers understand it, act upon that, better for this world to survive. With that, we end up today. Thank you everybody for your time.
Thank you.
With top investors putting climate change high on their agendas, more tech companies are launching software that can help oil and gas producers keep track of their carbon footprint and show